Hello everyone, this is Dr. Bindhu Priya. I am a consultant urogynecologist from Hyderabad. In this video, I would like to share few important information about post-hysterectomy surgery. So what is the recovery going to be like? What are the important precautions that you need to take? And what are the do's and don'ts? First most important question the patient would have in her mind after the surgery while getting discharged is, so what kind of diet she can have. So I would say try to have your regular normal diet depending on how your digestive system is accepting. And usually you can expect some amount of bloating after the surgery because the kind of medications that you are taking, especially antibiotics, can give rise to some amount of gastritis. But it is very essential for you to include a lot of fresh fruits and vegetables and high protein content in your diet, because these are the substances that is going to help in faster recovery and better wound healing. Commonly asked question is, can I have a bath? Can I have a shower? Of course you can. Usually these days, especially with laparoscopic hysterectomy or robotic hysterectomy, the sutures, they are not a very big issue. But even in case of open hysterectomy where there are stitches on your tummy, because of improved suturing techniques and improvement in the suture materials that we are using, so usually you can go ahead and take a bath and there is no problem of the sutures getting wet and getting infected. Usually for few days we ask you to cover it with a waterproof bandage, and then maybe after 3 to 4 days of surgery, even that is not a very big issue, and you can have your regular bath. And the third question that the patient has in her mind is, should I take complete bed rest? So again, the answer to this question is no. So because with complete bed rest, there is a high risk that the blood is getting clotted in your lower limbs, that is legs, and this can lead to certain kind of thrombotic problems in the postoperative period. So for that reason, we ask you to be ambulatory, that is, you have to keep moving. So depending on your energy level, so it can be in short intervals like around 5 to 10 minutes, but whenever you are comfortable, and then try to increase this interval slowly. So usually in around 2 weeks of time, probably you will be able to get back to your regular and normal pace of walking. And what kind of other activities that have to be restricted are lifting heavy weights, too much of strenuous activities, too much of straining, avoiding constipation, that is not straining too much at your stools, and then maybe climbing stairs, sitting on the floor, sitting cross-legged, and using Indian toilet. This may be difficult during the initial 2 to 3 weeks after surgery. So these kind of activities, they have to be avoided. Also very important to know that sexual intercourse has to be avoided for at least 6 to 8 weeks after surgery. And what is the recovery period going to be like? Usually we expect complete recovery in around 2 weeks of time, and again that depends on what kind of surgery that you have undergone. If it is a minimally invasive surgery in the form of laparoscopic or robotic or a vaginal surgery, the recovery period would be faster. If it is an open hysterectomy, probably in around 2 weeks of time, 2 to 3 weeks of time, depending on again how big the incision is. So your recovery period is going to be